We are Bariatric Supports. We're an interdisciplinary team of engineering, health, and science students. 1 out of every 4 patients develop some form of pressure injury during their hospital stay. And not only are the patients at risk, but the healthcare workers too, since 50% of musculoskeletal injuries in the staff are caused by patient handling. And of those injuries, 30% are caused specifically by bariatric patients. This is typically caused by the shear and sliding of slings underneath bariatric patients. These slings are used for the lifts to get them from one place to another. And also the manual labor that's required in the rolling and sling fitting of patients causes stress in the healthcare workers. Typically in the hospital, each bariatric patient needs to be repositioned every 2 hours. You need 2 nurses per patient to reposition a patient 12 times a day. This amounts to around 1 million working hours spent on repositioning annually. And this is at Grand River Hospital alone. And from those hours, you're wasting about $40 million just on these repositioning hours. We aim to reduce the number of nurses required for repositioning from 2 nurses to 1. So our solution, Bariatric Supports, features inflatable air bladders under existing hospital bed sheets that will aid in the rotation, the repositioning of patients, and sling fitting. We provide a scalable, affordable, and modular solution to add onto any kind of bed. We aim to protect delicate skin, support bariatric patients, reduce strain on nurses, and improve cost effectiveness. Existing mechanized beds that provide the lateral tilting, these go for around $20,000 to $40,000, and these require replacement of the current beds, since the mattresses themselves have to fold and the beds themselves have to tilt entirely. However, our air bladders can be attached to any kind of bed and go for less than $200 per unit. Here's a top-down view of our proposed idea. So, beneath the patient, underneath the bed sheets, so that they're not in contact with the inflatable portions, we'll have 2 sections of inflatable sections. And once inflated, you can get a patient to around a 30-degree tilt. And we've done some research, and it turns out that the 30 degrees is optimal to relieve pressure. And this can be repeated every 2 hours on either side, reducing the need for manual labor entirely. Here's a cross-section view as well of our proposed sling fitting idea. Since underneath the patient you have 2 sections of inflatable wedges, you can inflate either side in tandem, and you can get them from their supine position, which is the patient laying face up, onto their lateral side. And once they're on their lateral side, you can deflate one of those sides and place the sling underneath so that the patient can roll back over on top. This avoids all shearing and sliding, which causes lots of friction for the patient. On the right here is the bed. The pink part is the patient's pillow, and each inflatable section is highlighted right there. So this is the website that the staff will be able to see, either a website or an app. They can log in as a nurse, log in with their password, and this is their patient dashboard, room number, bed, and ID, and specifically the time since last reposition. Every 2 hours, the nurse will be notified to flip and set this patient on their side, so they can set them to 30 degrees. Now the pressure has been redistributed. Same for the right side at the other 2 hours. And they can even set their own angle. As you noticed, the timer has reset. So the next 2 hours, they'll be able to flip them again. Alright, and that was our prototype, our physical prototype with our patient dashboard, which can both work as a web app or a mobile app. If you want to see the results and sort of our process right after we just finished, check out Suki's video through this QR code. It's also on YouTube if you want to see more.